Hi, my name is Carolina Reduzzi, and I am assistant professor at Weill Cornell Medicine in New York. Breast cancer, as of today, the mortality rate has fallen because there is a earlier and earlier diagnosis. However, there is still a higher mortality when the cancer reaches the fourth stage, so when it's spread in other sites of the body. And regarding the treatments, they are still administered based on the expression of specific markers, biomarkers, that determines the subtype of breast cancer, which can be triple negative, hormone receptor positive, or HER2 positive. But in recent years, this has been changing and improving because also with the advent of liquid biopsy, the tumors, we can get much more information about the tumor characteristic of each patient, and so we can really target the treatments based on the specific characteristic. And not only that, but we can also monitor during the disease course how these characteristics change to follow this and at each moment try to give the patient the best therapy. Yeah, liquid biopsy is the translation of tissue biopsy, but in body fluids. The most common one is blood. So what it means is that researchers can now take samples of blood or other body fluids and look for material that is released from the tumor in these fluids. In particular, we can look for tumor cells or tumor-derived DNA, RNA, and vesicles. And all of these analytes can be used to get information about the tumor without going through invasive procedure like tissue biopsies. And the good thing is that this can be repeated with a simple blood draw over time and during the treatment to even monitor the response to treatment. Yeah, you actually have to apply very specific technologies because, of course, when you take a blood sample, most of the material in the blood will be blood cells, so normal cells. What you want to look for is for those very rare tumor-derived either cells or DNA molecules. So you need to use specific technologies that get rid of this normal signal and look for the tumor-derived signal. Yeah, for example, for circulating tumor cells, which is what I work mainly on, you can have instruments that do an enrichment of these circulating tumor cells based on the expression of markers or the different physical properties. And they can be big instruments, small instruments. There are many, many technologies that have been developed over the last 20 years. Biomarkers are things, let's say, that we can use to either guide treatment to detect the presence of the tumor. So for example, for liquid biopsy, a biomarker is the presence of circulating tumor cells or the expression of specific proteins on these cells that can be maybe targeted with treatment, or the detection of a specific mutation can also be a biomarker. So information about the tumor that we can use to understand better the tumor or to guide treatment.